My name is Catherine Wegwe Mwaura, the head of Faculty of Nursing. Under the Faculty of Nursing, we have the Department of Nursing, where we run certificate courses, we run basic diploma courses and higher national diploma courses. We offer a course in nursing, that is certificate in Kenya Enrolled Community Health Nursing, where students are admitted in 11 campuses where this course is offered. The students get an opportunity to go to class, go to the clinical area, and gain the competences and the knowledge that they require so that they can graduate with a certificate in nursing. Once the students have done a certificate in nursing, they have an opportunity to upgrade their training so that they can be able to acquire a diploma in nursing. So these students are admitted again in our KMTC campuses, in most of the campuses, and the 11 that offer the certificate in nursing. And these students usually get an opportunity to do the course through distance education, where they gain the competences, where they do work-based learning, and then they are allocated specific hours as per the curriculum to meet their competences and be able to join the diploma nurses. So the certificate nurses are at the lower level of the training in nursing. They are the nurses that you probably be finding in the low levels in the Kenya social package for health, where they work in health centers. They are the first line of nursing in those places where they will take care of the patients, diagnose them, make interventions that using the nursing process, where they use the basic nursing knowledge to provide nursing care and be able, when they are not able to perform some of the responsibilities that are done by the diploma nurses, they send them or they refer them to the other levels of healthcare, where now the care will be taken over by the diploma nurses. But the nurses are well trained. They have specific courses that are prescribed in the curriculum. And this is one of the courses that has really helped the KMTC and the nation at large, because of the areas where the healthcare providers are not easily available. So these nurses will be posted in the very, very far places, and therefore they are able to provide the services, ensuring that universal health care is provided at the lowest level. In Kenya Medical Training College, we offer diploma courses. We have 3 programs specifically that offer diploma. These days the courses run for 3 years, and the students will require to have a mean grade of C. They need to have a C in English or Kiswahili. They need to have attained English in biology or biological sciences, and they also need another subject, that is chemistry or physical sciences, where they'll be required to have a C-. These diploma courses are offered in the majority of the campuses, especially the Kenya Registered Community Health Nursing, in the 50 campuses that KMTC have that offer nursing. The students who do the Kenya Registered Community Health Nursing are usually equipped with basic nursing skills, which make them general nurses. And then they are also equipped with midwifery, that they can be able to take care of the pregnant women, the women desiring to have children, the mothers who have delivered. And then the other component of the Kenya Registered Community Health Nursing is community health, where they will go out in the villages, they will go out in the communities. Then they can be able to understand the challenges that the communities are facing, and using the skills that they have acquired, then they can be able to provide community health nursing. For Kenya Registered Nurse in Midwifery, this is a program that we started about 5 years ago. It is offered in 3 campuses. That is, it started in Homa Bay, and then it is done in Kakamega, and currently we have the course in Musoriot, KMTC. This program, as we are aware, there is a lot of issues revolving around maternal health, that is improving the quality of care for the mother and the child. And so this course equips the nurse with specific midwifery skills and competences that they can be able to provide this service. And this course is unique in its curriculum, because it has targeted those who specifically want to do Kenya Registered Nurse and Midwifery. They get the nursing skills, but in addition, they spend more time acquiring the midwifery skills. Again, in terms of the period, they'll take 3 years, and these students will graduate as Kenya registered nurse midwives and will probably be working in the maternity units or in the places where maternal child health care is needed. And then we have the Kenya registered nurse mental health and psychiatry. This is a diploma course that runs for 3 years, offered in Mathare KMTC. It is also offered in Portris KMTC, and it is offered in Muranga KMTC. This is a unique course that prepares the nurse to go out and take care of the community and the people, the clients and the patients who have mental health and psychiatric issues. As we are aware, mental health and psychiatric issues are on the rise. So this particular nurse is equipped with the necessary competences, the knowledge and the skills to go out there and diagnose patients or clients who have mental health or who are inclined to have mental health issues, then come up with the ways and possible means of taking care of them, and sometimes even preventing mental health, because we know that mental health and psychiatric issues can be minimized by prevention. So this course, the students will graduate and then they will work possibly in the best place they work in where clients or patients have mental health issues. But that is not to say that they cannot work in the general units, because even in the general wards, in the general hospitals where clients and patients are, some patients will still be requiring mental health support. We offer courses that are referred to as higher national diplomas in nursing. These are provided for the nurses who have trained at the basic level. They have acquired a diploma in either Kenya Registered Community Health Nursing, or they have acquired a diploma in Kenya Registered Nursing and Midwifery. They may also have acquired a diploma in Kenya Registered Nursing and Mental Health and Psychiatry. Once they have attained this qualification, they are given an opportunity to come and specialize so that they can take a pathway that they feel comfortable with. One of the courses that we have under these programs is ophthalmic nursing, which is a higher national diploma. This is a program that is offered for 1 year in KMTC. The students come to class and then they have a whole year when they are within the classroom, and then sometimes they are taken to the clinical areas to deal with the issues of ophthalmology and eye care. This course is very useful to people out there, especially in the community, as we are aware that the ability to see is a human right. And therefore, we need to pay extra attention to our eyes. And so we give these nurses the competences, the knowledge and skills to be able to understand, be able to diagnose, and even be able to predict those who may have eye care issues so that we can avoid blindness. As we are aware, 80% of blindness is actually avoidable, or it can be reversed so that nobody goes blind when someone can intervene. So these nurses, they'll come and then they will go out with a higher national diploma. They'll work in the hospitals, they'll work in the clinics, they'll work everywhere where there are patients who require eye care. And also because they have a component of community health, then they will be able to go out there and be able to look at the people or maybe the stakeholders, the people in the banking industry or wherever they are that are interested in eye care. And so they will support the eye care teams and become professional members of the eye care team. The second higher national diploma offered in KMTC is higher national diploma in perioperative nurses. This nursing is the course that is done to provide the nurses and to equip them with competences and skills to be able to provide care for patients who are preparing to go to theatre, who are in theatre, or who have left theatre. These graduates are provided with skills to be able to handle the client intraoperatively, postoperatively, and also be able to deal with the equipment, as we know that in terms of theatres and operating theatres, we have special instruments that are required to make the work of the surgical team easy and be able to provide the best outcomes. So these nurses will be able to undertake theory and also do practicals, and then they are assessed, and then once we are sure that they have acquired the competencies that are necessary, then they get a higher diploma in perioperative nursing. They can also work in units where possibly these days we have noticed that people have come up with surgical units where patients go for daycare. They can work in patient theaters and other surgical teams where patients are being prepared or they are being operated. So this is a special course that we would want a nurse who has done a basic diploma to come and be able to take more skills and specialize. KMTC offers a higher diploma in palliative care nursing. This is a course that a nurse who has qualified or has attained a basic diploma or a degree would come and specialize in palliative care. Palliative care is one of the special areas that the need is increasing day by day because of the non-communicable diseases that are ongoing and that are increasing every day. The palliative care nurse is prepared with the skills and competences in being able to identify patients who require palliative care needs, and these are patients probably who have a long life illness or they have what we call life limiting illnesses that is going to reduce or be able to interfere with their quality of life. And these palliative care nurses are trained to establish how they can be able to help a patient even though they are having a long life illness or a life limiting illness. They can be able to intervene so that we never have an opportunity to tell patients there's nothing we can do. So they are taught a lot of communication. They use therapeutic communication. They are able to apply many models that are used in palliative care to come up with what we call the pain concept. And in the pain concept, we look at a patient's physical needs, we look at the patient's psychological needs, we look at the patient's emotional needs, we look at the patient's spiritual needs, and we can be able to determine which area of what Cicely Dems talked about in the care for palliative care, which area are they having difficulties, so that we can be able to support them, so that once they are undergoing these therapies, maybe they have been put on treatment, they're on chemotherapy, they are going for surgery, they are going perhaps for palliative hormones or something. This patient, you don't only look at the wound or look at the disease, but you look at them in totality and provide skills that you help them feel appreciated, help them to feel like somebody cares about them, and then they can be able to be helped so that when they leave our hospitals or when they are at home, we follow them up, and then we can be able to determine what are the family needs. Because once a patient has a long illness, this impacts even their relatives and their family. It also impacts their work. So the palliative care nurse is able to look at all the areas concerning these patients and provide the specialized care. It is a program that runs for 18 months. It has a mixed mode of delivery. That is, the students will come to theory, and then they will also be able to have a work-based learning where they are able to be assessed, and also the lecturers will go out there and find out whether they are able to meet the needs. So it runs, as I have said, 18 months, and it is offered in KMTC for people who have done basic nursing. It is a very good course that I would encourage people to look at and to come and do, because it is helping very many people who feel like they have reached the end of the world because of the life-limiting illnesses, but they don't need to feel so. We are able to support them. In KMTC, have a higher national diploma in nephrology nursing. This is a course that is offered to care for the patients who have renal conditions or diseases. This course runs for 18 months, and this course is found as a regular module. The students come to class. They are here with us for 1 year, but they will have, sometimes they'll go to the clinical areas, they'll go to the renal units, they'll go to critical care units, so that they can be able to acquire the skills, so that they can be able to offer dialysis services, they can be able to take care of patients, and perhaps those patients, especially with non-communicable diseases, who are likely to get renal diseases, patients with diabetes, patients with renal disease, other renal diseases, acute and chronic, those patients who have hypertension, those patients really who are predisposed to renal disease. So they will be able to learn the theory and then be able to go to the clinical placement areas and then determine, using the nursing process, the needs of those patients to either prevent them or to care for those who have already suffered renal disease and those perhaps who require dialysis. So these nurses They also have components of research so that they can be able to improve renal medicine, and then they are also able to do leadership and management so that they can offer leadership to either the people working in the renal units, and also apply those skills in taking care of the patients in the hospitals, in the clinics, or wherever it is that the patients are available or are admitted. KMTC offers a higher national diploma in critical care nursing. As we are aware, the pandemic, that is the COVID-19, taught us great lessons, where we realized actually we need a lot of critical care nurses, because when the pandemic came, we were not very well prepared. So this course has been offered for many years, and the students who come here, they will get theoretical modules, and they will also get practical modules where they are given competences, the skills, and the knowledge that is, and even the right attitudes to care for patients who require critical care nursing. This is a very specialized and a highly specialized course where the students require a lot of information, a lot of knowledge, and a lot of skills that are tailored to prevent and to protect patients who cannot be able either to breathe for themselves, they are not able to take care of most of their basic needs. So these students will undergo specific modules that will help in terms of caring for a patient who is under a machine or a vent and they are not able to breathe for themselves. So the nurse will make sure that the patient receives the oxygen at the right amount and at the right time and in the right way, and be able to determine what are the hemodynamics that probably have changed because the patient is not able to breathe for themselves. And also these students are able to diagnose patients perhaps who could be going into respiratory failure or renal failure or any other condition that will lead you to critical care. And those patients perhaps who are maybe sometimes you find they are unconscious, and maybe because of an accident, or maybe they underwent surgery and they became very critical and they have ended up in a critical care unit. These nurses will work in the basic critical care units. They will also work in higher dependency units where patients they have not yet reached the level perhaps where they are permanently on vents or on support, oxygen support, but they are sick enough to warrant them being in a place where there is a lot of close monitoring. They also work in the renal units because most of the renal patients usually have critical care illnesses, and therefore they will work with the renal nurses and be able to support these patients. The critical care course is offered in Machakos, KMTC. It is also offered in Nairobi, KMTC. It is offered in Kilifi, MTC, and Thika, KMTC, and many more campuses are looking for ways of actually mounting this course because of the urgent need, especially following what I have talked about, the pandemic, the COVID pandemic. So the KMTC is going out all the way to ensure that we have enough critical care nurses so that our clients, our patients in the hospitals and out there do not lack or do not suffer until they cannot be able to be, to be restored back to life or even given the dignity in their illnesses. This course runs for 1 year. It is regular, but there are plans to make this course go work-based learning to 18 months so that we can be able to acquire more students and also be able to give our students an opportunity to work even as they learn so that we can increase the numbers of the critical care nurses. KMTC offers a course in Pediatric Nursing. This is a course that deals majorly with children with illnesses that require, as we are aware, that our babies and the young children, they have special needs. Sometimes they are not able to speak for themselves. They have needs, but they cannot express themselves. And so when they are sick, they require someone to be able to determine what their challenges are, come up with a diagnosis, and be able to provide the nursing care that is appropriate for children, because there are special areas that in terms of drugs, in terms of the decisions that we make for a child, that will be different from an adult who is being given general nursing. So these nurses, they acquire the specific skills in neonatal nursing, they acquire special skills in child care, so that we can be able to improve child care and reduce morbidity and morbidity in children. And also these palliative care nurses, they can be able to work out in the village and communities, because they do get a component of community health nursing. They also get leadership, and they also get research concepts, so that even the issues of children, they can be able to make decisions that can improve nursing practice for children and the young adults. So the course is offered in Kisumu, KMTC, and it runs for 1 year, and the students will be on campus for 1 year, with the times that they will go to the clinical areas, in the wards, in the children's wards, in the children's clinics, to be able to acquire the competencies. KMTC offers a higher national diploma in Kenya registered nurse anesthetist. This is a unique course that was introduced because of the major need, especially for patients requiring surgical interventions, so that we can be able to reach the patients. They can be able to get the surgical operations, the surgical care at the lowest level and wherever they are, perhaps in the Kenya Essential Package for Health. This course allows the nurse and prepares the nurse to acquire competencies to do with intubations, to do with patient care before, during, and after theater or surgical operations. These are nurses who are able to intubate the clients. They are able to measure the hemodynamics of patients who are under surgery or who are going to undertake surgery. And it is one that has really helped improve the access to care, especially for patients, because we know for a long time patients used to be sent maybe to the higher levels of the Kenya Essential Package for Health so that they can get surgery, because we don't have enough anesthetists. So this nurse is uniquely trained and is able to provide the care that is required. They work under their colleagues who are in that team, the team of anesthesiologists and the other people who provide general anesthesia and take care of patients in theater. And I can confirm that they are very well trained, and they have been providing very essential packages, and we are asking anyone else who is willing to undertake this course to come, so that we can improve and increase and be able also to improve universal health care and access. KMTC has prepared a curriculum for geriatric nursing as a higher national diploma. This is a unique course that will take care of the aging populations, as we know that there are very many physiological, psychological, and social needs associated with aging. And so these nurses will be equipped with the necessary knowledge and the necessary skills and the necessary attitude, so that they can care for our aging populations. As we are aware, because of the improvement in care, our people are living longer, and we are praying that they even live longer. But as they age, they will require special care. So, and that's why we want to train these nurses so that they can offer this service. The course is going to be 18 months, and it is going to be mounted in Thika KMTC, and also going to be mounted in Nairobi KMTC, and many other campuses will probably take it up as the courses grow. And we want to believe that we'll be able to determine, the nurses will be able to determine the needs and the aspirations of the old and the aging, so that they can provide the basic care. KMTC offers a higher national diploma in psychiatric nursing. This is a unique course that is offered in Mathare KMTC, where the students or the learners are going to learn about how to take care of patients with mental illnesses and mental challenges, patients who require psychiatric review, patients who require determination of and prevention from developing mental health and psychiatric issues. The course runs for 1 year, and it is offered as a regular program. And the course, the students will be in class and take the theoretical modules. They are also going to take the practical modules. These nurses are very well prepared to be able to offer psychiatric and mental health nursing. And the students will be able to go out there in the community, go to the hospitals, as we know that mental health issues are not isolated, and they are now on the increase. So this higher national diploma will be able to prepare this nurse, and they can be able to improve the care of patients who require mental health and psychiatry support. KMTC offers a higher national diploma in family health nursing, because we know that the needs of the community, and usually the household is where care would start, and we can be able to take care of patients and be able to support them, so that we actually do not have them ending up and crowding our hospitals, so that once we are able to single out a family maybe is at risk, we are able to help them come up with strategies that they can apply, strategies that they are familiar with, to be able to avoid diseases. And maybe if they have diseases, what interventions can they make before they reach the hospitals? So the nurse will actually use the Calgary assessment model to come up with the needs and look at what is the developmental stage of that family. Where are they? What maybe that family is a very young family, where maybe they have just gotten married, they don't have a child, but they do purpose to have a child. So they are prepared to, so that they can understand what is it that they need to do to be in the right shape of mind and even in physical condition, so that when the mother or the wife becomes pregnant, she can be able to have a healthy child and a healthy delivery. We are also able to look at maybe the family is old, it's an old family, maybe they have grandchildren, or they are at the point where they're just about to have grandchildren, and look at their needs and be able to see what is it that needs to be addressed, so that when now the children, maybe the grandchildren have come, what are some of the needs that we can do for those grandchildren, even as we take care of the parents and the grandparents, so that we avoid diseases that can easily be avoided, and also be able to support the families, so that they can know that prevention is better than cure. Because when we have a healthy family, then we have a healthy community, and we have a healthy nation, and the world at large. And this course is offered in KMTC Nairobi. It's very unique, and this course helps the nurses, even those who want to work outside Kenya, can be able to apply the Calgary model in assessing the needs of families and be able to provide care all over the world. And so this course runs for 18 months, and it is done both theory. The students will take theoretical modules, and they will also take theoretical modules. The nursing profession and training in KMTC has grown a lot. And one of the things that we have realized, that the course has become very marketable. Though it was marketable in the past, it is becoming even more marketable now, especially with the migration of nurses to the outside nations, to America, to Europe, and to the other countries. And so the courses are tailor-made, and the curriculum is developed in such a way that a student will acquire the knowledge, the attitude, and the skills that they will be able to use not only in Kenya, but they can be able to use them all over the world. And it has been the practice that the Kenyan nurses have been going out. The many countries in the world are looking for the nursing graduates. Although we train for ourselves, because we don't want again to take away the need of nurses in our country, we still train them in a way that once we have gotten our own nurses, the numbers that we require, the ratios that we require, we can have others go out there, and they can be able to earn revenue that is going to help the nurses, their families, and the country at large. So the nursing courses are tailor-made. If you're doing a certificate course, it is tailor-made by the curriculum that the nurse is going to go through, or the student is going to go through, so that once they complete, they are well-baked. So we do not have any half-baked nurses. If they're doing a diploma, again, they will require the required and the necessary and the appropriate skills and the knowledge and attitudes to be able to work at that level of a diploma. We also are looking at our nurses who are moving from the certificate, and then they are able to upgrade and do a diploma. And now we are not even limited, because our nurses who have the diploma course are able to do a basic degree in nursing. They take a shorter period, and then that way they are able to compete with the market. They are able to compete among themselves and among nations with the basic degree in nursing. And our nurses from KMTC have also been known to go up to the master's level, where they have done masters in nursing or other areas that are related to nursing, perhaps in leadership, in education, even in research, so that when they do those master's programs, then they become even more competitive. And we are not only limited to masters. Our students are also going all the way to do PhDs in nursing and areas that are relevant, and we have been able to see the excitement among the students, among the KMTC fraternity, the ministry, and the other sectors in health and other sectors, because of what the nurses are able to achieve today. And again, I want to repeat the issue of the students and the nurses upon graduation, going out there to offer services. They have given KMTC a niche and a name so that when people are looking for nurses, they will remember, and many times they will say, we want a Kenya medical training or trained nurse, and that for us is a plus. Again, our students are not limited, or our nurses upon graduation, they are not limited to working in hospitals, so that people don't say, oh, once I do a nursing course, I'll work in the hospital. The students or the graduates will work in places, in banks. They are going to work at the research levels and institutes. They are going to work in leadership. They are going to work at the WHO. They are going to work so many areas where they can be able to provide their services and the training that they have been given. So KMTC training the nurses is doing a great job, and I want to encourage everyone who wants to do nursing to come and do nursing, looking at working locally, nationally, and even out of Kenya and beyond overseas. So nursing is a good course. It is very well structured. The curriculums are reviewed regularly so that the students can be able to address the emerging and the re-emerging issues. They are well trained to understand what are the needs of each community individually and collectively, and therefore be able to provide that specialized care. And with the many higher national diplomas, the nurses are able to compete, and they are able to look for jobs all over and be able to sustain themselves. So nursing, as I will say again, is a good course. It is well structured, and we have many reports of the good things that the Kenya medical training nurses are doing out there. To apply to be a student in nursing in KMTC, we have our systems that have been put in place. We are able to go to the admission portal, and you are able to follow the instructions that are well illustrated, and you are well guided on which course you want to apply for, so that you can follow those procedures. One of the things that you will require at least to go to a cyber or to use your phone, because it is online, so that you can go there, look at the courses, then decide which one you want to do, whether it is Kenya registered nursing, whether it is the one for midwifery, or the ones for psychiatric, or even a higher national diploma, and even the certificate. So you apply, and then you can upload your documents. We have a system where you pay online, and then that information is received in our admission office, and then verification is going to be done. And those that are able to be picked out, those who meet our criteria, will be selected so that they can now come, and then we will start the journey of training them to be nurses.
My name is Leah Itukei Mamai. I'm pursuing Diploma in Nursing, Nairobi campus. Upon the completion of my course, I will be a Kenya registered community health nurse, and as a nurse, you can work in the maternity as a midwife. You can also work in the community as a community nurse in the community setup, or you can also work in the wards as a general nurse. My learning experience here in KMTC has been the best thing I've ever dreamed of, because we have everything that we need to learn. For the first year, when you're in a first year, you go to class, then you come to skills lab. Skills lab, we have every experience. Before you meet with the clients in the hospital, you have to be exposed to the demos. We do the demonstration, we do the return demonstration. Then from there, we go to the wards to experience now with the real life experience with patients to take care of them. For you, anyone who is willing or you desire to join a medical course, I invite you to join KMTC, because KMTC offers nursing as a course. We have certificate, and we also have diploma. Certificate is a 2-year course, then diploma is a 3-year course. Nursing outside there, it has been a myth, but when you come here, you will see the real thing. You will love it. We save lives. We bring lives here on earth as a midwife. And also, if you want to apply, you can visit our KMTC website. You can apply there. It's only 2,000 shillings and some 30 shillings, so you can just be ready for that, and we welcome you so much. It's the best place that you can ever be.